Dr. Abigail Hassan. I know she want me to mention the middle name, but you'll hear from her, you know. Well, just about now. Good to have you join us in the studio, and of course, welcome.
Thank you very much for having me.
What did you say?
I said thank you very much for having me.
Okay, okay. Good to have you. You want me to mention the middle name?
Yes, please
You
do.
do that yourself. You do that yourself.
Okay,
Okay.
it's not that hard. It's bury them. But don't call it like that. Call it bury them as son.
Okay. It's okay. What can I say? Dr. Charles Adogo, I can mention your name more very well.
Good
Right.
I
morning.
feel terrorized.
No, don't be. You don't have to be terrorized, okay? Okay, and then everyone sit back and relax. We have a whole lot to talk about. Like I said, yes, it's all about health emergency response. Yeah. I would say health emergency management, or which other one I will put them again. But then, what we want to do today is we want to talk on some basic issues in order to actually, minimize the health consequences of, say, outbreaks, pandemics, mental wellness emergencies. What do I call that again? Emergencies caused by natural or accidental hazards, and well, all of these involves anticipating. It also involves responding to it, and then recovering from the impact of hazardous events, or conditions, as you want to put it. But then I will be narrowing down this whole thing to three basic ones, just three, and that's stroke. When I say stroke, some people won't fear. Yeah. So in case you have someone who is suffering stroke, conversation via YouTube, we're streaming there. You can watch us live, like I said. YouTube is Voice of the People 90.3 FM, or in short, VOP 90.3 FM, and you're just right there. Okay? Yeah. Let's get talking. Let me begin with Dr. Abigail. Emergencies in Nigeria. How we face it, how we
Was told that his gratuity had been paid, and like every other person, we just went, and then the news came. Oh, it was a false rumor, and of course it was 85. The shop, he collapsed, and I was just standing. There were others grown up, of course. It's a banking hall, and surprisingly, my memory does not remember anybody knowing what to do. Everybody was just, oh, blood of Jesus, oh, give him water, oh, give him this, give him that. Well, I lost my dad. Years later, I found out that that was a situation called sudden cardiac arrest.
all right.
I volunteered in the university, but I never thought I would be doing it, because I felt like, oh, society offended me, they wronged me, so why should I save a life? 2 years in between, I lost two cousins, so also preventable causes, one diabetics, and the other was sudden cardiac arrest again. And I realized that change wouldn't happen except to become the change you're looking for. And I started as a civic responsibility, going from community to community, then organizations, then schools, just to train on basic first aid. What do you do in terms of out of hospital emergency? Because the honest truth is, many persons that die in the hospital don't die because they couldn't be saved, but because the initial first aid that is needed to sustain them until they get to the hospital, they couldn't access it. So I now started going from place to place, and I think we've been to like 13 plus states. I also partner with other non-governmental organizations that deal in this,
Okay.
because I have a foundation of my own
All right, beautiful.
that actually dwells with that, how to ensure that persons have basic skill to save a life, particularly as it relates to out of hospital sudden cardiac arrest when it sets in, because they only have 0 to 4 minutes.
Hmm.
And if you don't do something, there's absolutely, you just have to do it as long as you know what to do.
Dr. Charles, responding to cases in Nigeria, emergency cases in Nigeria can be cumbersome. I don't know if you think otherwise.
Yeah, very true. When it comes to emergency situations, we know Nigeria as a country is a country that preparation is always a problem. We wait till the last moment before we take action. So many times when most emergencies happen, we are caught off guard. People are at a loss at what to do. People seem confused. They run helter-skelter. Everything they need to help may not even be available at that time. And to even buttress it, like she said, people are even not skilled in terms of what the knowledge and the technical know-how, that has to go with resuscitation or, trying to revive a patient, for instance, who is unconscious. So basically, we have a lot of work to do in terms of creating awareness in terms of emergency response. We also have a lot to do in terms of proper health education and skill acquisition, for the populace, because you don't have to be a medical doctor to save a life. A doctor can't be everywhere all the time. In a particular gathering of people, you may not even find any doctor. You don't even have many doctors around anymore. So the more people are enlightened and educated in terms of emergency responses, the better it will be for the general populace, because emergencies, like we know, they occur unexpectedly. Nobody gets any notice ahead that an emergency is about to occur. And emergencies happen every day in the churches, in the schools, in the marketplaces, even on the streets. So it's very essential that everybody is armed with these life-saving skills, so that when these emergencies present, people will not be at a loss.
In these, how long have you been doing this?
Okay, so I started learning because, well, I'm still learning.
Okay.
I just got recently certified by American Heart Association as an instructor, actually.
Okay.
I started learning between 2011, with field work, to 2014. Then I took it up personally to be going to places from 2021.
Okay.
I now started that as almost a full-time job. I just go to communities and train, just give out the skills, unpaid. But
to really do, to be sure that, okay, this is what the thing is. But there are still some baseline, some basic stuff like the ABCs. You can't go wrong with that. Making sure that the airway is patent, removing all the secretions from the mouth if there are any, making sure that the nostrils too are free of any secretions, and placing the patient in a position that would assist breathing effectively. And then you call for help, because when that happens, you can't handle it on your own. At that time, somebody is making a call to the emergency responses, an ambulance is getting ready, and that is not the time to be looking for the hospital to take the person to. Okay. You alert the hospital also that a patient is coming, and you give a brief history of what is coming so that they can prepare effectively, for such a case to come. Basically, it's also important for people to know that having your medical history, your medical history, yes, is a confidential information. It's peculiar to you, but it's also very necessary that if people can carry a little tag of something that that will make them be easily identifiable, that you are an asthmatic, you are an epileptic patient, or multiple conditions in one individual. So it's very possible that as you're managing one condition, you may be worsening another underlying condition. For instance, a person who is hypertensive, who has an hypertensive emergency, and who is also asthmatic, some of the antihypertensives are contraindicated in asthmatic patients. Yeah, so you're able to know that, okay, this person has both conditions, and this is how we can best manage this person without trying to jeopardize.
Okay. Now, doctors, let's get down to the basic issues. How to manage these persons who have these ABC conditions. The first one you mentioned, just let me take it from you, is a person that is hypertensive. Okay, and if it happens all of a sudden, maybe you're in a bus or something, I don't know, and it happens, how best do you take care of such a person to help the person, and you just want to help the person stable, to become stable? How do you go about that?
Well, hypertension is not written on it. After a while, they just stop taking their medications, and these complications can occur. So once you see people like that, you know that they need to go to the hospital immediately. But for people that you can't really tell what is causing their sudden loss of consciousness or their disorientation, all you just need to do is you make sure that they are in a safe place where they cannot get injured. You make sure that the airway is patent. You make sure that their breathing is fine, and you make sure that the pulse rate, that's the number of heartbeats per minute, is stable. If it is not, then you need to call for help. It's not what you alone can manage there. But if you notice that there's no breathing or there's no pulse, then you may need to institute what we call the CPR.
Okay.
So the CPR is a cardiopulmonary resuscitation.
Let me talk to Dr. Abigail now. You've been handling, so to speak, emergency cases for a while now, but I found out that Nigerians, people still run away from such cases. If you have to do emergencies, please just don't go there. You understand? Just leave it. People want to run away. Stay away. Sometimes some medical practitioners too really don't like such cases. If it has to do with emergency, they will say, "Now in hand, it happened now," and they are not well.
Result of what has happened to you inwardly. So yes, we don't get enough persons coming out because of that behavioral and the possibility of being accused. If the person doesn't survive, there is that fear of, oh, will I have to write statements? Will police come and carry me? It's easy if it's a medical doctor and you just say, oh, I'm a medical doctor, and they will just let you go. But you as a lay person, if I tell them I just wanted to help, will they say it's what I did that killed the person? But that is why if you're trained and you're certified, you are not just doing it, you know what led to that. Because another quality of a first responder is to be able to give accurate information. Like my very good friend said, when you call, you need to say what you saw. Or for instance, I know 767 works a lot in Lagos. When you place a call, hi, my name is Abigail, I'm at Third Mainland Bridge, comes, please give accurate, don't skip what you did. Particularly orthopedics would say, oh, please don't train on tourniquet, but tourniquet is the worst that can happen. So when you apply a tourniquet, write the time, so that by the time they get to hospital, they will know, oh, can we still...
Thank you so much. Let me also again ask this question. Dr. Charles Adeogun, diabetes is something that is prevalent. It is everywhere. In fact, everybody, diabetes, little children. I am now surprised. I see young children, 18, having diabetes.
Usual, and then other congenital anomalies that can come, with that. That's malformation in the child. So basically, it's something that has a genetic basis. It runs in families too.
Yeah.
So you find out that there are some factors that affect or increases the risk of somebody developing diabetes. So genetics is one. Secondly, you have the body weight. The body weight is also an important risk factor. People that practice sedentary life, chronic alcoholics, also have an increased risk of developing diabetes, apart from the greatly needed by the body. So these are the important factors that can increase a person's chances of developing diabetes. So when this happens, basically, they present with certain symptoms that are often overlooked, or because of ignorance, or they're not aware. The public is not really aware of the important red flags. You can find out that the person would notice that they are thirsty all the time. They feel like urinating frequently all the time, large volumes of urine. Their appetite increases. They are always calling for food all the time. And we call diabetes starvation in the midst of plenty, because complications can also occur from uncontrolled diabetes. So diabetes is not a joke at all, and it affects people of different age groups. So you are right to say that children also have diabetes, like the type 1 diabetes we mentioned, and in some cases even the type 2 when they are obese, because there's an astronomical weighing over 100 kg, and you are one
round is good, All of a sudden he drops. The second is he looks so dull and so tired and weak and all of that. And he begins to ask, so why? I asked him to always tune in on Thursdays, between 10:30 and 12, to always listen to, programs like this. He's someone who loves politics so much. But I told him, hey, and not be every time we discuss politics here. Let's also talk to ourselves health wise. So I don't know if you can relate that to diabetes.
Absolutely. Any man that has a
Or
if you go on vacations, a lot of people leave.
No, if I'm for vacation, forget them.
In perpetually
Forget them.
high
Oh.
stress. So perpetual high stress conditions. So those high stress levels, are going to affect, psychologically and emotionally too.
First show for
The first time. Why are you asking me a second? Please don't ask me. Should you hear the first time? Then that's it.
But aside that, I want to also mention the fact that getting to travel out of Lagos most times have made me realize that yes, we it's a center of excellence, but we actually have to be very intentional about ourselves because I now carry that part of Lagosian in me to another place that see time, see sleep. I cannot still sleep. Be more, you want to sleep more. Are you in an enabling environment? So let's look at it end to end. So I want to sleep till 8 a.m., but I have to put food on the table, right? Does my environment enable me? Like you talked about Ondo, I was there, and that's where I had that experience. They have that enabling environment where, so it's both ways. Either your employer or the organization you work with by 8 a.m.
When last did you go on a vacation? Or how is your sleep like? And they say in Lagos, who is sleeping? Is anybody sleeping in Lagos? Then you say that's the problem.
Or we both go live in country.
Travel
far
to
the
another
we go
place.
Travel far to another, just to relax.
And have a
He go get
vacation.
Uber, we go call him. Please take me here. Take me here.
During his vacation, you dare not call him and tell him anything related to work. No, you won't. But here we keep stretching
And he will be
ourselves.
paid for going for that vacation to go on leave.
No, I'm talking about in Lagos. You can never be on free leave.
That's no leave. That's actually still working.
Working from home.
Exactly. So basically, the quality of sleep one requires, at least we usually say 6 to 8 hours of sleep should be sufficient for an adult. But now we found out that a lot of people have what we call sleep disorders. So we can just broadly classify what those sleep disorders are. Some people fall into the category of they have problem initiating sleep, meaning that they can't fall asleep. And some people have a problem with maintaining sleep. That means they can fall asleep, but once they wake up, to go back to sleep is a problem. So if anything makes them wake up, that is the end.
I'm on that table.
so they cannot sleep again. So basically, a lot of people trivialize sleep because they say it's not just sleep, but sleep is an essential part. It's a natural phase that you go through to refresh you, to rejuvenate you, and to make you, have the vitality to start a new day. Because the stress of the previous day is still on you. You have not,
338. Okay, but if you can call in quickly, you'll be very. Jude, please bring these doctors more often, because Niger politics is destroying our mental health. Please, more doctors, less Niger politics.